Hello, friends. Dr. Lisa here, cancer rehab specialist. And today I want to share with you some of the mobility and gentle stretching drills that I teach my clients who are having hip pain related to taking aromatase inhibitors or estrogen blockers. So very common when taking those medications to have joint pain in different parts of the body. And the hip is one of the areas that many of my clients say they have a lot of discomfort. So I take a less is more approach and start with gentle mobility drills to increase blood flow and the flexibility of the ligaments and tendons and muscles in the area. And then, if we need to, we progress to some strengthening exercises. So stay tuned. There'll be another video for strength exercises specifically for hip pain on aromatase inhibitors. So today we're doing gentle mobility and stretching. So you may start on your bed or on the floor. Here we go. Okay, laying down, you may have your knees bent or legs straight. Either way, we're going to start with the right leg, hugging that knee in just gently and doing some gentle circles, clockwise and counterclockwise. Next, we're going to hug that knee into the same side shoulder, so right knee towards right shoulder. If your knee doesn't like the pressure on top, you may move your hands to underneath the thigh, trying to take as much slack out as possible. You get a stretch in the back part of the hip. Now, if you feel a little pinchy pain in the groin, just shift position a little bit until you are away from that pinchy discomfort. So about a 10-second hold here. And then we'll release that knee until it's right on top of the hip, holding behind the thigh. And we're going to press the heel to the ceiling, pulling the toes back and release, because that can be an intense stretch. So we're not going to hold it very long. Active mobilization, stretch and release. Stretch and release. Last one, kick it up and let it go. Good. We'll release that leg out. I'm going to hug the left knee in. Start with some gentle circles clockwise, lubricating that hip joint, giving it some nice, gentle attention, changing direction. Our joints in general will always feel better with movement. And when we're more still, things become stiff. So it's nice to have an easy routine. Now we're going to hug this knee in towards the left shoulder. Nice gentle routine to keep that stiffness from creeping in on us. Taking a couple of breaths here, adjusting the angle if you need to. Good. Now the knee comes right on top of the hip. We press the heel up and release. Up. Release. Good. Keeping the toes pulled back towards your nose. Good. I know this can be intense, and you may not get as far as me. That's just fine. You do what feels best in your body on any given day. These are not competitive stretches. Good. We'll release that foot down. We're going to bend the other knee. Let's have the arms out at the side with the palms up, taking the feet a little wider, and rotate both knees to the right while trying to keep the shoulders down. Good. Bring the knees back to center. Press both knees to the left, keeping the shoulders down. Always being mindful to go as far as feels safe and comfortable. Also feels like a stretch sensation. Back to center. We'll go one more time to the right. Good. One more time to the left. You can always do more. This is one of my favorite stretches, so if it feels good, go ahead, do a few more. Excellent. Okay, back to center. I'm going to roll onto my side to sit up. And now we're going to do the money stretch, I call it. I love this stretch for really getting at some of those deeper muscles in the hip. You get that nice bit of relaxation in the tension and pain relief. So I'm side saddle on the table. This leg is sort of draped back into any position that's comfortable. I'm not pretty particular. You can even have that leg out here if it's more comfortable. I like it draped back a bit. I've got the left thigh pointed to the foot of the bed. I'm going to turn my shoulders to be in that same direction. Sit up nice and tall to maintain that length in my spine. Take a big inhale. Maintain the length in the spine. As I exhale, I'm folding over the left thigh. And right here, I begin to feel the stretch deep in the left hip. Just the beginning of that stretch. But I'm just going to pause. Take a breath. All the way out. I feel a little bit more room there, a little bit more space. Think a little deeper. Inhale. Exhale. All the way. Good job. Thinking a tiny bit deeper, only as far as feels safe and good. I would rate this intensity of stretch to be maybe a 4, maybe up to a 5. You don't want to be too aggressive. Good. So that was 3 or 4 breaths on that side. We'll switch over to the other side. Again, letting the back leg drape down, the front knee now facing the head of the table or the bed. Shoulders are rotated so they're in line in that same direction. Lifting the heart. Inhale. As you exhale, fold over that thigh. And you may feel, like I feel right now, that my right hip is tighter than my left. You may have one side tighter than the other. Just know that that is completely normal, because we always have a pattern where we like to cross our legs, a pattern how we like to sit or go up and down the stairs, and we will have one side that feels different than the other. Working with the breath as you feel a little kind of letting go in that area or a little more space created. If it feels good that you can lean into that hip, fold over that thigh a little bit more. Wonderful. I love that stretch too. Okay. Wow, that felt really good. I hope that it felt good to you. Let me know the result if you went ahead and did these stretches. If you like this content, if you want more information like this, please subscribe to my channel, like this video, leave a comment, share it with someone that you know would benefit. You are not alone having joint pain while taking aromatase inhibitors. And there are many, many breast cancer survivors just like you. And I want to provide as much free content with tips and tricks that I've learned over the years to help you to be able to complete all your treatment. So thank you for watching. I wish you the best.